Oh, hey, today we're going to be talking about what are sexual problems. So, according to medicine.net, sexual problem refers to disruption in sexual response cycle. In other words, one or both partners can experience satisfaction during their sexual activity. How common are they? They're more common than you think.
Sexual problems can be broken into 4 different categories: sexual desire, sexual arousal, orgasm disorder, and sexual pain.
The first category of sexual problems is sexual desire disorder. The number 1 sexual desire disorder is hypoactive sexual desire, or HSD. HSD is the low desire to engage in sexual activities with one partner or multiple partners. The causes, primary versus secondary. Primary is lifelong, and secondary is like just a current problem, something that you haven't had in the past. Global versus situational. Global is in all different settings, and situational is just in certain settings. Or total versus partial. Total is consistently, and partial is occasionally increases. All of these are biological issues, and all of these have psychological factors. The biological factors could be including hormone imbalances or neurological problems, and the psychological factors are relationship issues, cultural issues, or just somebody's stress. The solutions to hypoactive sexual desire is cognitive therapy. Cognitive therapy has 3 steps. The first step is to identify the problems. The second step is to strategize on how to eliminate the problems. And the third step is to eliminate the problems and bad thoughts.
The second category in sexual problems is sexual arousal disorder. For men, the most common disorder is erectile disorder. It is the inability to maintain or attain an adequate erection during sexual activity. And some causes are biological, and it could be caused by a blocked artery, that could be caused by smoking, or psychological, which could be caused from anxiety or depression, and social, caused by relationship and cultural issues. The solutions for erectile disorder are medications such as Viagra and Cialis, and they don't give you erection, but they help the body produce a sexual stimulation. Males experience erectile disorder, females experience female sexual arousal disorder, and just like ED, it is the inability to attain or maintain sexual arousal during sexual activity. There are several causes of female sexual arousal disorder, and a biological one could be hormone imbalance. Some psychological ones consist of fear, anxiety, guilt, and depression, and also relationships can be a cause. The solution to female sexual arousal disorder is directed masturbation, which is where a female and her partner get in touch with her sexual responses. The category of sexual problems is orgasm disorders, and for females, they get female orgasmic disorder, and it is a sexual problem that a female cannot orgasm properly, and some causes are organic, such as side effects to medication, hormone imbalance, and drug and alcohol abuse. Some psychological causes could be abuse in the past, and female orgasmic disorder can fall into the primary and secondary category, primary being where a woman has never experienced an orgasm, and secondary where she's currently not experiencing one. And just like female arousal disorder, directed masturbation is the solution. Second orgasm disorder for males is premature ejaculation, which is the tendency to have an orgasm with little stimulation. And some causes of premature ejaculation are sensitive to sexual stimulation, pelvic and genital reflexes, and relationship issues, longer abstinence between the partners, and condition to quickly ejaculate, and also higher testosterone. And some solutions for premature ejaculation are sensitive focus, which is distraction for the male, and also the squeeze technique, which helps the male learn to control his orgasm. For males, they have male orgasmic disorder, and it is also referred to as delayed ejaculation, which is the inability to ejaculate after long periods of stimulation. And some causes that are organic are medication side effects, and some psychological could be anger and relationship issues. And 20 to 35% of men have this disorder, and some solutions to it are cognitive therapy.
The fourth category of sexual problems is sexual pain disorders. Our first sexual pain disorder is dyspareunia, which is very common. About 40% of women have felt this type of pain. It's any type of pain during sexual intercourse. Your pain can be in the vagina, in the vaginal opening, or in the deeper abdominal cavity. The causes are lack of vaginal lubrication, which can happen if a woman isn't sexually excited or if a man tries to enter before she is fully aroused. It can also be caused by infections of different types of infections are vaginal infections, bacterial vaginosis, STIs, and herpes. Or you can have deep dyspareunia, which is pain in your lower abdomen, which is caused by the penis stabbing the cervix. In men, they can have infections also, but their infections are of their testicles, the penis, the prostate, or the anus. Or they can have dyspareunia due to inflammation of penile skin, which is caused when they masturbate too much without adequate lubrication. If you have any of these symptoms, you should go see a doctor so that they can diagnose you for the proper reasons and give you proper treatment from there. Our second sexual pain disorder is vaginismus, which is pain prior to sex. It is the contraction and spasms of muscles around the vagina. It's not studied very well because most people don't know about it, so we can't give an accurate percentage of how many women have it. Some causes are all psychological factors, which stem from fear of a traumatic or painful sexual intercourse, which can come from any of the past experiences like childhood sex abuse or some painful past intercourse. Maybe somebody experienced some rape or sexual assault or STIs. The solutions are a 3-step process. The first step is sensate focus, and the second step is learning voluntary controls of surrounding muscles, so not when to tense up and how to relax it. And the third step is vaginal insertions, obviously starting small, as small as like a pencil, and moving up to the size of an erect penis. Some optional solutions are Botox injections, which loosen the vagina muscles.
So today we talked about four different categories of sexual problems. First, sexual desire disorder, sexual arousal disorder, orgasm disorder, and sexual pain, and other specific disorders within them. Causes of these varies, but psychological, biological, and social are more common than what's out there.